Hi, I'm Dr. Michael DiTolla, the Director of Clinical Affairs for Sirona Dental, and I want to welcome you to the Sirona Media Panel at the 2016 Chicago Midwinter meeting. We've got a guest with us today. We have Sandra Dumancic from Quintessence Publishing. Sandra, how are you doing?
Fine, thank you.
Thanks for being here. Quintessence is based in Berlin, an international company, and you actually are in Croatia.
Exactly.
Where you guys publish in the Croatian language for the dentists in that country.
Exactly. We're trying to bring all the relevant information to Croatian dentists and dentists in the region in general and Southeast Europe.
And of course, Sirona being originally a German company that now also has a headquarters in the United States. That was one of the initial countries there and around in Europe where this idea of single visit dentistry was first kind of presented to those dentists, and it's caught on a lot here in the United States as well, where everything's all about convenience, drive-throughs, 24-hour, pharmacies and donut shops and everything like that. So, but it's still worth doing for the patients to be able to do it in a single visit. I wanted to give you the opportunity to ask our panel, two other clinicians, Dr. Todd Ehrlich and Dr. Michael Skramstad, a couple questions that you might have regarding these types of products.
Well, first I have to say that patients in Europe are not that much different than patients in the US. Of course, everybody wants to come and get things as fast as possible, but to have the best results. And that's the presentation we saw today was something that shows that it's possible, and a new development that probably you're going to say more about how it's used in clinic. But I wanted to ask another question is, when you decide on a new product, how important it is to have data published in journals such as Quintessence journals, to have relevant information about the product and some data to confirm the studies that are done. I'm amazed to hear that Sirona invests about 6% of sales in research and development, and that's very important to have such a valuable information once you start using the product. Right?
Well, personally, Quintessence is one of the magazines that I think we have a higher level for. We all know in all our trade journals that some have better quality, some don't, some are research-based, some are not. And Quintessence gives us the ability to, weed through some of the good things, some of the bad things. And so, I don't know, Mike, what would you say?
I think it's important. I think research is always important, for some dentists more than others. But if you're ever going to kind of break through to the mainstream, you have to be supported by research and all the materials. Mike was joking before when Bruxer was first released. It was there was really no research on it, correct?
Right.
Yeah. And so, but it turns out, it stood the test of time. It's really worked. Same with Emax. When I believe Todd was actually one of the original beta testers of Emax. Really no research, but it's something new. We use it and it all turns out good. Now 10 years later, or 5 or 6 years later for Bruxer, the research is starting to come in that it really works and it's really standing up to the test of time. So I think in the end, both those materials are going to turn out to be the most heavily research materials that we have.
Well, and also, sorry to interrupt, but it's not really so much brand new things, it's just a brand new way of producing it. So we're still dealing with zirconia that's already been tried and tested, and so it's just a new way. So the research into that, I think, is going to come more from clinicians like us on how we're using it, how we're able to get it done in one visit, and the patient perception of it as well. And what I like about your magazine is the photography and the way you tell and portray.
Case studies, right?
The case studies are always very good, yes.
Yeah, and really in my opinion, we read all these articles and read about the research in the lab, but I think that in some senses the best research is just anecdotal research from your office. And what you see over the last 12, 14 years that we've been doing this, that we know it works, we know what doesn't work and what does work, and that's almost better research.
That's how I always felt at the laboratory, because at my last job, we worked with 48,000 dentists a month who sent us crowns. And their preps, most of the preps we got were not nearly as good as these two guys. And so you send out all 130,000 crowns a month, and because there's a no-fault remake policy, you find out when they break or not. That's one kind of research, but the other kind of more academic research is being done at your alma mater. I asked you before we started, why is your English so good? Because my Croatian's really bad. In fact, it's non-existent. And you said I went to the University of...
Because you haven't been there, so you have to come.
But you're an alumni from the University of Michigan, where Dr. Dennis Fassbinder, somebody who works close with us, does a lot of research and now has 15, 20, 25-year studies on a lot of the materials being used for chairside CAD-CAM. So it is important because when patients come into the dentist, they don't ask and say, well, show me the research. They just trust, they have a bond with the dentist, and they trust they're going to make a good decision. On a more kind of practical level, here in the United States, we have Gordon Christensen and Rella at CR, clinicians report, who do testing, and they've been testing solid zirconia and Emax. They're now up to 5 years, and they're both performing very well. And I just have to echo what they say as well. Quintessence to us is something that we look at as kind of a wow. I mean, it's just really done well. It doesn't come free in the mail, and it shouldn't. My only complaint with it is that I haven't been on the cover of Quintessence, but maybe that's a good decision rather than.
Well, they have a higher standard of quality.
Yeah, they do. Yeah, no, it was just a tiny little 5-pixel picture that I was actually on. So to your point, yeah, I think research is very important. You shouldn't just go out and do something. But that's what we did see dentists do years ago with solid zirconia, and as we said before, fortunately. It turned out okay, that it ended up being a decent material and worked out well. Do you think European dentists are more concerned with things like that, about really being able to see research, than American?
Obviously, research is always good, but I think you're right. The most important thing is the practice, how you can use the material, how you can use different equipment, and what the response of the patient is. So I think it's important, and like you said, when you do several things at your office, to publish it, so the other practitioners can know what can be done with a different material. And so I think today is important to have zirconia as also another thing that can be used. Zirconia has been used for many years now, but this is a new approach, and if you tell a patient that in 90 minutes or so he or she can have a crown done, finished, in place, that's wonderful, I think.
I was saying to the Sirona CEO who was up here earlier how nice it is that we're releasing something today that's really already been out there and shown to be in high demand by dentists. Can you imagine if solid zirconia hadn't been out there before and we were having to try tell this story at the same time, the kind of skeptical looks
that story wouldn't even take. People wouldn't, so at least
it'd be too far out there.
It'd be too far out there, and the fact that this category of material is already well regarded and everything, it's now we're in the method at how we're producing it, which really makes the biggest difference.
When I do research in my office, by the way, if I'm going to do something for the first time, it's always on a family member, usually an in-law. Well, it's going to be done for free. And I don't know, when you guys did you remember your first solid zirconia crowns?
Or your assistant?
I did on my sister.
You did on your sister.
I did mine on my sister.
That's a good example, on your sister, and you did on your
dental assistants.
Right. We see these people as expendable. We see them as human guinea pigs. But it goes to your point that when you try something for the first time, you want to try it on somebody who you know is not going to get really angry.
You never know.
if it doesn't happen to work. And so, but clinical research, sometimes, like Todd said, we get a little caught up in the journals that come free in the mail, and it's easy to look at something and ooh and ah at it.
I think it's room for both, for different types of journals. But I think what Quintessence is trying to do is, for 60 years now, or more than 60 years, to publish relevant data for other practitioners to see. So Quintessence is kind of the basic of knowledge that you need to use new procedures, materials, and stuff. So I think it's room for everything, but obviously Quintessence has the agenda and the aim to publish articles that can be relevant.
Well, it'd be nice.
Have support by research, obviously.
Right. It'd be nice at one point to have a chairside solid zirconia article in there as well, probably from one of the two gentlemen seated to your left. And you can tell that we all hold it in very high esteem. If you asked us to list, the publications,
and if you publish an article in Quintessence, we publish a photo as well. So
right. Yeah. But not on the front.
That's all you get.
But still, it's important.
Not on the front cover. Well, Sandra, thank you so much for your time. We love Quintessence. We love having you here as a representative, and thank you for your questions.
Thanks
so on
for
behalf
everything.
of myself, Sandra, Todd, and Mike, I want to thank you for your time and your continued commitment to quality dentistry.